My name is Reis. I'm a Brazilian-trained ophthalmologist, and I currently practice full-scope optometry in Vancouver, British Columbia, Canada. I know that my patients are improving when I look at all the quantifiable parameters I have available to me. As Peter Drucker said, if you cannot measure it, you cannot improve it. And in dry eye practice, that means looking at your tear breakup time, your corneal staining, meibography, but more importantly, the patient questionnaire results and tear osmolarity. When my patients come back and they ask me, am I getting better? It's very important that I have some parameters to show them and empower them and encourage them as well that they are improving day by day. So I look at the tear osmolarity and the patient questionnaires as the core parameters I use. And that also helps with compliance, because once they realize that they are getting better, even if sometimes there is a disconnect between the signs and symptoms, it helps them continue with the therapy, and that enhances the clinical outcomes. The best way to overcome objection when you're talking to patients is not to try and negotiate with the patients and convince them that what you're doing is important, but to actually show them the reason why it is important. So when you're backing yourself with an algorithm that took inspiration from studies such as the DEUCE-2, for example, there is this wealth of information, wealth of published papers in the literature that provide you with support in your clinical decision making. So let's say you have a patient with severe dry eyes and they say, I don't want you to follow this protocol because I've tried everything. That happens quite often in my practice. And in that case, what do? You show them, well, this is where you fall on the algorithm, and now we have a clear pathway of what needs to be done. And this is why we're doing things this way. I normally have the studies that were used for that algorithm to be created in my office, and I show them, this is the link, this is the document, take it home, read about it, or you can just trust me and I know what I'm doing, and they'll follow you for sure. So the best way is not to negotiate with them, but to empower them in understanding why you're making those decisions. They're not arbitrary, they were well structured to begin with.